I haven't dated anybody.
In 13 years.
In 13 years.
How does that make you feel?
Oh, stop it. Terrible. Yeah, terrible. I just feel like somebody's not gonna want me, you know? My friends who are positive, some of them are in healthy relationships. Like they've gotten married and they found somebody. But in my mind, I'm like, I'm never gonna find anybody. Like, that's just not gonna happen for me.
Somebody that I hooked up with, before we got anywhere, I let him know. And he was like, all right, let's just stop what we're doing right now. Like, let's just stop it all together. And I was so offended, because I'm like, what do you mean? To have that kind of reaction was, for me, solidified all of those fears that I had. That like, if you tell people this is their reaction, you're gonna look like a leper, then they're gonna tell their friends, and then they're all gonna think you're a leper, and then it's,
I'm literally an open book, and and being an open book, you definitely get stigmatized. You definitely, have people judging you constantly. It definitely took a lot of self-reflection, especially because in our scene, it's so stigmatized. It's stigmatized. And that's the reason why nobody likes to talk about it. Nobody wants to talk about it, especially with trans women, because it's almost in our scene expected for us to get that.
There's stigma in a institutional level, in a systematic level. So many doctors, others, clinicians, they carry a lot of stigma about HIV, and they don't want to offer tests. Even the simple offering of a test, which should be universal, is felt to stigmatize. Well, I don't want to offer the test because I think I'll be insulting my patient. We can't even get out the front door then, if there's that level of stigma, even among the medical community. And then there's stigma within the individual themselves. Right. Because they feel like many patients would say, I just can't feel normal. And that's where the U equals U and the virus being undetected is really powerful, because that sort of starts to help wash away that internal stigmatization.
People can be rather ignorant. People can be judgmental. Anything that's dealing with sex is often taboo. I have a virus. I don't have a disgrace. It's a virus. I don't have anything to be ashamed of. I have a virus. And it depends on who I'm talking to. Like, I wouldn't walk down the street yelling it. Of course not. But walk into a restaurant and discuss it. But no, stigma has never stopped me from talking about HIV or saying I'm HIV positive. No, never.
I wouldn't want to wish this on somebody. It is a lifetime of guilt and shame that you're trying to work through, and not everybody has the ability to do that.
Self-acceptance is difficult. Scared of being judged, scared of being looked down upon. Like nobody wants to feel that.